Assalamualaikum warahmatullahi wabarakatuh. We are from Group 13 and today we'll be presenting about eating disorder. Psychology disorder is something that relates to how we differentiate on a normal human being with someone who has an abnormal psychology. Psychology disorder, it actually consists of mental health illness such as bipolar, depression, anxiety, and stress. So in Malaysia, mental illness has been such a concern to the society because after the COVID hits, we actually place we place mental illness as the second most dangerous illness that Malaysia has faced, because it does not only affects on ourselves but it also affects everyone around us. So this is why Malaysia takes mental health illness seriously. In psychology disorder, we also consist of eating disorder. So in the next part, I will be telling you on what is eating disorder and how does it affect us physically. Eating disorders are psychology problems marked by significant and ongoing disturbance in dietary patterns and the uncomfortable thoughts and emotions that go along with them. So, eating disorders has actually various types of eating disorder, such as bulimia nervosa and anorexia nervosa. So today we'll be talking about anorexia nervosa. So what is actually anorexia nervosa? An eating disorder that primarily affects teenagers who wants to limit their calories intake in a day. This actually happens in young female teenagers. We have chosen a short movie called Twig. So this short movie actually tells us about the struggle a young female teenager that has faced anorexia. Even though she has all of the support by her friends and by her family, she still faced the struggle in dealing on eating. So we choose this short movie to show you how actually anorexia nervosa can physically hurt somebody, even though it does not appear in physical forms. In our perspective, anorexia can be tough on some people, especially to those who are facing it, because some people who face anorexia felt that they are disgusted by the way how they look in their own body. They feel uncomfortable and they wanted to lose their weight by using a very unethical method, such as vomiting out by the food, exercising excessively, and not taking a proper diet nutrition, which could lead to a serious complication besides by losing their weight. Some complications that could happen when you are facing anorexia is that you could face heart failure, muscle weakness, and even more severe, which is death. In this short movie, the female teenagers did not eat for the whole day because she felt uncomfortable with her body and how she looks. Everyone is comfortable with their looks, so they decided to take a drastic measure by not eating the whole day and not taking the proper nutrition diet. The short movie ends with the young female not getting the proper treatment that she should have, and even though she had the support moral by her family and friends, it is not enough. She should seek for professional help. In our opinion, we believe that anorexia nervosa is dangerous to an individual being, but it can be a treatable eating disorder. As an individual living today, most of us have to live up standard, especially if you're a woman. Anorexia is so common in women. It actually saddens us that we had to live with this disorder up to this day. By exposing how dangerous is anorexia to an individual and how we can treat the disorder, I think it's a good way to aware people that not everyone feels comfortable inside their own body.
Learning behaviors such as classical conditioning, which is a neutral stimulus and S that is linked together with the unconditioning stimulus UCS in order to create a conditioned response. So, in this context of anorexia eating disorder, The NS is that the woman and man may begin to relate having thinness or having a slim body. They wanted to be attractive and perfect that meets the unreal beauty standard, which is the UCS, and this occur as a result of both receiving the same attention and adoration, which is the unconditional response UCR. Based on the short video of this issue, people with anorexia previously did not pay attention to the media, especially in the fashion industry. But then, they feel vulnerable and more conscious about their body, which leads to trigger a response, which is the conditioned stimulus CS. Thus, they tend to eat less than usual and lose weight, which is the conditioned response CR, and this may also persuade anorexia more.
Assalamualaikum Doctor, my name is Karol Amalim, Nometric 277582. I'm going to explain the answers for question 3. The main biological foundation that we have identified from the video are that an anorexic person will suffer from structural brain changes and also will affect their nerve systems. For example, an anorexic person will suffer from structural brain changes from abnormal activity which will alter their frontal, parietal, temporal, occipital, and also subcortical systems. Furthermore, it will also affect their nerve systems, making them experience disordered thinking, numbness, and also seizures. Overall, an anorexic person will experience an adverse effect on their parts of their brain, as their overall activity will be likely alter their functions of the brain.
Hi, my name is Muhammad Haziq Aiman. Today, I will share with you a suggestion on how to treat anorexia. First, you need make nutritional counseling session. This therapy will make initial assessment of the patient and plan a proper diet. The patient will advise to take more nutrition than usual, and the doctor will monitor and evaluate the progress of the symptom. So, the food planning target must be able to help patient gain weight within 500 gram to 1400 gram per week. Okay, the second suggestion is to make family-based statement, FBT. This is effective method and save cost compared to other method. This method has 3 phases. Phase 1 is weight restoration. Family need to play a role by creating healthy eating pattern and controlling their children behavior toward a healthy lifestyle. Second phase is returning control. At this stage, family can already control the eating disorder, create a regular food pattern, and improve mood stability patient. The third phase is developing identity. For your information, at this time, the patient has successfully reached 95% of their ideal weight. Parents are encouraged to reassess their life together following the intensity of the previous phase and look at plan for the future. This treatment focuses on helping them develop healthy balanced life and catch up on other developmental issues. At this time, mental and behavioral problem patient can be reduced. That's all from me. Thank you.
Assalamualaikum, my name is Farah Adibah and my metric number is 278916. I'm going to continue the presentation by addressing 2 theories we identified from the video we reviewed. The first theory is none other than the eating disorder theory. This is a condition where the patient developed an abnormal eating pattern due to dissatisfaction on their current body figure. The abnormal eating pattern is developed to achieve an unhealthy body figure. In this video, anorexia nervosa is the specific condition that the patient suffered from. This is when an individual reduces food consumption in order to retain or to reduce weight below the normal body mass index. The second theory that can be seen in this video is the perception theory. This theory explained that perception is established through the process of choosing, categorizing, and embedding meaning to the information an individual received. Defect may happen in creating perception. One of it is called hallucination. It is when only internal stimulation appear, which is created in the mind of the person. The stimulation then is misinterpreted. In this case, a vision of a female personnel appeared to be a friend of the patient's. The patient create response by interacting with the non-existent personnel. So to recap, the two psychological theories that could be related to this video are eating disorder and perception. Now I will let Shahira to conclude our presentation.
In conclusion, anorexia is a dangerous disorder that could endanger your life. It is possible to recover, which is a very wonderful news. It's critical to seek treatment and assistance as soon as you can recover. And if you know someone who is facing anorexia, please do help them. Please help them to seek out treatment because they do need all of your support and moral. It's never too late to seek for treatment, but doing sooner is to increase the likelihood to successful of recovery. So this is all from Group 13. Thank you.